Solutions to public health problems lie not only with the best available science, but also in bold policies. How we analyze and communicate health information is critical in the design, adoption, implementation, and advocacy of public policies. Welcome to the School of Public Policy series, profiling professionals with careers in public policy. Today, we invite you to join our conversation as we speak with Alina Salganicoff about her career in health policy leadership. Hi, I'm Whitney Sheridan, Director of Communications for the School of Public Policy at Penn State, along with Catherine Baumgardner, our Director of Professional Development and Student Engagement. Hi, Catherine.
Hi, Whitney. It's great to be here today.
Great to have you. Our guest today is Penn State alum Alina Salganicoff. She's the Senior Vice President and Director of Women's Health Policy for the Kaiser Family Foundation. The KFF is a nonprofit organization that conducts nonpartisan policy analysis, polling, and journalism on national health issues. Dr. Salganicoff is an expert on women's health policy and has written and lectured extensively on various issues ranging from maternity care and reproductive health services to aging and long-term care. She's also served as an advisor to many state and federal agencies. Welcome, Alina. Thanks so much for being here.
So happy to join you.
Well, we're excited to have you with us, and we want to let our audience know that this is an opportunity for you to talk to Dr. Salganicoff about her career path and her experience. So we want to encourage your questions throughout today's discussion. So don't hesitate to use that Q&A or the chat at any time throughout the discussion. So Alina, I wanted to start by asking you what led you down your career path. What originally drove you to work in health policy?
Well, I can tell you for sure that I didn't wake up one day and decide that I wanted to do health policy. Sometimes, you really can't tell what your career track, what leads you to your career track. And I actually can, as I think about it now, when I was in high school, I was a candy striper in Philadelphia. I grew up in Philadelphia at a hospital called St. Christopher's Hospital for Children. And I was actually working it was in very low income, predominantly Hispanic, Puerto Rican neighborhood in Philadelphia. And I loved it. It was really a great experience, but I did get to see firsthand a lot of the struggles that a lot of the patients and their families had in terms of accessing healthcare, and also the other factors that affected their care and their access. And then, when I was in college, I was a psych major. And then I got a job working on a hotline for reproductive healthcare and doing advocacy and community education. And at that point, I realized, wow, our system is really broken. Women couldn't get access to care. Many of them had Medicaid. Doctors wouldn't take Medicaid. They couldn't get in for appointments. And I was kind of, yelling at one doctor at a time or arguing with, receptionists about scheduling patients, and realized this is, if you want to make change, this is not how to do it. And so then I kind of learned about policy as a career, and I thought about public policy. I thought about actually thinking about going to law school, but didn't think I was cut out for that. And then I kind of came upon a program in public health and healthcare policy. And that suddenly the lights went off, and kind of that set me in the career working on healthcare policy. But initially I started working on Medicaid policy, which was really my interest, continues to be my interest. But really, Medicaid is a program that's so important to women throughout their lifespans. And, when they're girls and in their reproductive years, pays for over half of, in some places, over half of births. And then, caring for low income elderly, half of our nursing, it's 2/3 of our nursing homes are populated with women. And many of those women are low income women on Medicaid. So that's kind of but when I was going through it, I felt a lot of confusion and was kind of trying to figure out. My brother was an engineer. It was very clear for him.
And I can imagine those connections that you formed in working one-on-one has really helped, you really empowered you and motivated you to to stay in this arena and really fueled that passion that you have. Can you talk a little bit more about that?
I mean, I think at the end of the day, for me, it's like, what can we do to improve our health system for people? And a lot of the kind of low wage, what I call, work that I did, everything from, waitressing to cleaning houses to doing, market research on the phone, really, to jobs that had no benefits. And, I would have had no coverage had my parents not been able to help me. All of those things really shaped the work that I do today and the lens in which I use to, think about the policies that we want to highlight.
Now, Alina, when we talk with other speakers and we talk with our students, we often talk about the crooked path that gets us to where we are. And you had shared with us when we were meeting with you before some of the really early experiences that you've had that we oftentimes can discount as a way to influence us toward a career path. So if you share with us some of those things that students often want to leave off their resume because they just don't think that was important.
And I don't know that you necessarily always want to put them on your resume. They're certainly not on mine. But I think that a lot of times we discard, as I was mentioning earlier, my work waitressing, catering, knowing what it's like just, not to have insurance, or to know, if you get sick, you don't have sick leave, you get kicked off the schedule. Cleaning houses, knowing what it's like to clean somebody else's house, and, and knowing that I had an education, I just didn't have a job, and there was, a future there. But, all of those things really kind of shape the lens and the type of work that I do today, I think. And even though I felt like it didn't, that work didn't matter, it really does. And it kind of shapes who you are and who you are as a public policy professional throughout your life.
It's really important to pull on those past experiences as ways to enhance who you are as a person and what you offer going forward. And having had those shared waitressing experiences, I know exactly what you mean.
You know how to multitask when you waitress, there's a lot of skills that you get about life, about dealing with people, dealing with difficult people. How do you do that? How do you navigate that? Those are not things that, people necessarily think about that add value, but they really do. It's just a little hard sometimes to put it on the resume, but I think sometimes, I have kids who are college age who also kind of struggle, what to do and what matters, and really knowing that it's a road and it's crooked, and sometimes it feels like it has dead ends, but even those dead ends teach you something that you can gain as you kind of move forward.
You mentioned, a lot of the work that you've done work around Medicaid. You've done a work around a lot of different health legislation. You've worked on a lot of major policy reform and legislation. I wanted to ask you, what would you cite as your greatest accomplishment? Because you've worked on a lot over the years.
Yeah, I mean, it's hard to say. I think for me, it's hard to say what's my greatest accomplishment. Mm-hmm. One of my most rewarding policy experiences, I would say, for me personally, was being involved with the Institute of Medicine. I served on the committee that made the recommendations for preventive services for women that are required to be covered by insurance plans under the Affordable Care Act. And so one of those recommendations we made was contraceptive coverage, but we also covered well woman visits, breastfeeding services, intimate partner violence screening for women. So, being able to kind of do the review, the process that we went through was to do an evidence-based review of the research and make our recommendations based on where there were gaps from where the U.S. Preventive Services Task Force recommends, particularly focused on women. And so to actually be able to use my skills to, review research, see where the gaps are, and then actually have that lead to actual policy and actual coverage. And I'm still engaged in that. I'm now serving on the Women's Preventive Services Initiative on their advisory panel, which is like the board. And they are making recommendations to the Health Services Resources Administration that continue to expand screening services for women. We just approved anxiety screening, incontinence screening, screening for obesity for midlife women, so risk of obesity. So, you know, I think that's been really rewarding and really where I feel like my contribution has made a difference. But I certainly did not do that alone. There's a lot of people and a lot of advocacy working on that.
And I want to remind our guests that we are looking for your questions for Dr. Salganicoff while she's here. Put your questions in the chat or in the Q&A at any point throughout the discussion.
No, it's interesting to listen to greatest accomplishments, and I've long held the Kaiser Family Foundation in high regard with my work in health policy and my interest in those areas. And so much of what you're doing is helping to craft and shape the narrative for healthcare, specifically to women in the country. And I want to thank you for that. But I'd like you to talk a little bit about, what does a day in your life look like? What do you do in your role as Director of Women's Health Policy? How do you figure out where you navigate, where you spend your time and attention? What does your day look like?
You know, that's a great question. And it really changes, although I feel like right now I spend a lot of time in this room where I used to go to lots of different places. But I mean, I can give you kind of an example of the types of things that this week that I'm doing, you know, and part of what I have to balance is I have to be incredibly informed about what's happening out there in the real world in real time, and think about what are the issues, and, you know, be knowledgeable, because we are often called upon by members of the media writing about an article, and something can just pop out of nowhere. So, you know, have to really be following what's going on. And that does actually take up a significant amount of time, it feels like. But in addition to that, this week I had a meeting for the Women's Preventive Services Initiative. So we were discussing what the trajectory is for the coming year and coverage issues, and looking at, you know, what are the updates we're going to make. So that was one of the meetings. And then I am doing a briefing next week, a congressional briefing on contraceptive coverage and what we can do to strengthen that. So planning for that presentation and what's going to be involved in that. We have a series of research projects that are underway. So we're doing a national survey of women. So we have to kind of find the contractor. We have a contractor, but kind of negotiate a contract. And then to do the survey, we're developing the survey instrument. It involves meeting with other stakeholders, other colleagues and other organizations who are doing survey work, making sure that we are focusing on the right issues, asking, you know, for survey methodology, asking questions that have been validated. And if they haven't, what are kind of the most unbiased ways that we can ask that, trying to figure out what the sampling design is. So it's everything from kind of heavy methodology to, you know, figuring out what we, you know, what's going on in the world. And also kind of with an eye towards the future. And I'll give you an example of that. We have, you know, Kaiser Family Foundation is actually not connected to Kaiser. We are no longer involved with, there are no more family members involved, and we're not a foundation. So we are actually, as Whitney mentioned, we're a health policy research and information organization. So our work is also externally funded. So thinking about what are the projects that we could do. We have a project coming up that we're going to start later this year on how you get insurance plans to cover over-the-counter contraception, and how you might structure that. And so thinking about how, you know, how would you do that? Because there are 2 oral contraceptives that are now going through the process in the FDA, and insurance will not cover it if it's unless it's prescribed. So we're learning what we can from actually the experience right now about insurance being required to cover COVID tests. So really looking at what's happening in current policy that can inform also the issues that we're working on. So it's a lot of different things.
I want to ask you, we do have a question coming in, but I want to ask you a little bit more about communicating policy, because it sounds like you're communicating with a lot of different stakeholders, a lot of different audiences. I mean, that's a major part of what you do, but you're also communicating a lot of complex health issues and a lot of data that I can imagine is pretty dense. Can you talk a little bit about, communicating to different audiences and how you communicate that in a way that people can understand?
Absolutely. I think that is probably one of the most important roles that I play in my work. And I translate information to policymakers, to members of the media, to advocacy groups. And I will say, like, health care policy, what do they say? It's complicated. It's really complicated. And so a lot of people don't understand really basic differences. So I spend a lot of time actually thinking about how we're going to present our information and everything from kind of figuring out how to do this graphically in the way that's the easiest for people to understand, how to make sure that you explain things in a way that doesn't make people's eyes glaze over, even though some of it is, even for me, some of it is like, oh my God, don't make me talk about that. But, they're critically important issues. I mean, I'll give you an example. I'm doing this briefing next week in Congress, and one of the issues that they're very concerned about is oversight of insurance, making sure that insurance plans don't deny women contraception, the contraceptives of their choice, or put types of utilization controls on there when there isn't supposed to be. But one of the important things is somebody's insurance plan a self-funded plan or a fully insured plan? And a self-funded plan is regulated by the Department of Labor, and the other is regulated by the state. And that seems like, oh my God, who cares? And most people don't know. But if you're trying to enforce a policy, those types of difference, and develop policies to enforce implementation, those types of differences are really important. And so those details matter, and explaining them is a big part of what I do.
We have a couple questions coming in that I don't want to skip over, because this is what we're here for. We want to encourage more questions. Let's get this one from Eileen Galley. Good morning, Dr. Salganicoff. What's your advice for early careerists to expand their opportunities for fellowships and or employment at KFF? And we have some questions about that, because I know you have a job posting, as a matter of fact.
Job posting in women's health. We have a lot of job postings. I think one of the things we actually spoke earlier that I think is really important, and that I look for in an applicant, is some level of understanding and demonstration of research that you understand the work that the organization does and the research, the types of work that the job description actually says you will do. You would be surprised. I mean, these are like basic things, making sure somebody else, my kids are also looking for work right now, making sure somebody else reads your cover letter, your resume, making sure that it's as perfect as it is, because as it can be, because there was a lot of competition. We had one position and we had nearly 200 applicants for that one position. And so we do internships. We do informational interviews as well. I think that sometimes informational interviews, even earlier when you're a student, reaching out to people, and it doesn't have to be anyone necessarily at my level, but people who you see have written a paper that you think is particularly interesting, to reach out to them. All of the different staff members are kind of involved in decisions around hiring for their groups as well. So I think trying to make those kinds of linkages, I think, are really important. And it's not just like a one and done thing. If you want, if you want to work for an organization, you should really almost take it like a research project, figure out who are the people who are working in that organizations, where are the opportunities. If you can't get in on entry level. Look and see what type of paths people have had.
Okay.
Maybe that's not your first job. Certainly wasn't my first job. Thinking about, what kind of trajectory you might want to have.
So there are those opportunities for networking and things like that.
Yeah, absolutely. I mean, I think, networking is really important. Attending professional conferences is really hard right now, but that is really, I think, a really important part of work that's done, when you try to really just to see who the players are, who, might want to work. And I think a lot of times it's where you work and who you work with in the organization also can make a difference. So, just think about that. Sometimes, Kaiser is a pretty flat organization in a lot of ways. And so, that's, people have different trajectories depending on where they come in to the organization. So, kind of really try to study that as well. I think
there was one more question about finding your place in health policy that I didn't want to pass over because we do want to encourage those questions. After graduating from undergraduate or graduate school, was it hard to find work that focuses on health policy? How did you deal with finding your place in healthcare/health policy? This field seems so elusive.
Well, I will tell you, when I graduated from college a long time ago, I didn't even know about the field, about health policy. It didn't exist. You could do health administration, but health policy was not a thing, nor did I even have a clue that I could do something like this. And so, it is elusive, but I will say there's so many ways and places that you could work, you could work on policy, working for government, state government, local government. There are great opportunities as well as in federal government. I think you can actually learn a lot about policy, but working, in a hospital system and a healthcare system as well. And I think that you should look at it as this is not the end of your career just because you finished your degree. You are just getting warmed up, and so, think about what type of work that you want to do, or is there a type of policy or an issue that you want to fix that you feel, and I feel a lot of the people that work at KFF are people we're all kind of obsessed about, there's no borders. We were talking earlier about borders, there aren't borders where really everybody is engaged. A lot of us spend time, we'll send each other articles of interest over the weekend. Like, did you see that? Can you believe that? Oh, look at this, is really interesting.
Right.
And so those are kind of things that, it's like, what sparks your passion? I think it's important, if you're going to have a career, then you need to kind of find something that, really motivates you, that excites you and engages you, because careers evolve and they change. And sometimes you will change your career, but you will do something that's connected and doesn't seem apparent, but will build on experience that you have.
And that's something you look for in a candidate, correct? When you're hiring, that they're passionate about.
I feel like no, but if people are not excited about and care about the issue, then, I'll tell you, like right now we're hiring a health policy analyst for women's policy. I'm looking for people who, and it's somebody who has to do R programming and, really has some level of statistical experience. But I also am looking for something in the letter or a volunteer opportunity or something to tell me that you are interested in women's health, that you have spent some time thinking about it in some way, because otherwise you are not going to thrive working in our team, because we are people who think about this a lot in a lot of different ways. So, that's kind of an example where you don't have to necessarily have had that exact experience, but you have to show, and the cover letter is a great way to help frame that and explain that.
Well, and those key factors are probably so important as you look through what I would imagine hundreds of applications for these one job. So it's that piece that gets you onto the I need to peek over the fence and learn more about that person instead of putting it on the next pile.
And it actually happens both ways. Like some people have this very romanticized idea about what it is to do policy. And I'll often get like, I can remember a case where we were hiring for a research assistant, and I got somebody who was already a physician who kind of wanted to do policy. And I was like, I'm not going to like use a physician to help me do my, graphics, things like that, or do research, literature reviews. So really kind of look at the description, because the employer has spent a lot of time thinking about what they put in there. And so you need to show that you've spent some time thinking about what characteristics you have that make you qualified for that position. And I don't look for fancy like resumes. I want it to be crisp and clear, easy to read. And the important things that I need to know pop out.
Make it easy to find what you need, what you're looking for.
I see some really fancy resumes and layouts and stuff.
Lots of paragraphs that you're not going to sort through.
Well, yeah, and also like, okay, where is your education? Like, can I find that? Can I find where you worked? Things like that. So.
Something simple. Well, I want to pivot back just a little bit. You've given great advice, because I think it sort of all comes full circle. When you were talking about this, you navigate a complex data world, and how not to make eyes glaze over when you are presenting something you're very passionate about. There are times when you only get the ear of a powerful person or someone who can help to move your agenda forward for just a short period of time. So talk to us a little bit about the importance of the elevator pitch, or really being able to distill what you want to have happen down into, a few seconds of time, a few moments of time.
Yeah, I mean, I am not an advocate, so that those are not the kinds of things I do, but I think that really one of the important things in the elevator pitch is think about who you're pitching to. And think about how what you can say can engage something that they will be interested in. And think about what's your headline. I remember one of my advisors in graduate school, when I was pitching thinking about what I was going to do for my dissertation, she's like, okay, so you get a reporter to write about your paper. Like, what's a headline? Like, why should anybody care about this? So really, spend that extra time thinking about what's the point of this? Why is this going to matter to people? And, so that's kind of the really, I think, kind of important thing that doesn't happen, really spending that time ahead of time, distilling what really matters about what you want people to know.
Great advice for how to maximize that time, because you're not going to get it back. And
yeah, and I think a lot of times people think that just happens. Mm-hmm. Like, it's just like they don't spend a lot of time thinking about that. I mean, I will say one of the most complicated things that I've done is, Kaiser does a lot of these fact sheets. Mm-hmm. I've done a lot of fact sheets in my life, but fact sheets are really hard. What are, you're limited in terms of the space that you have. We used to be limited by just like two sides of a piece of paper, and your font can only be so small. And so thinking about, what it is that, what really matters. And I think that we don't spend enough time about that. I co-taught a class when I was in graduate school. One of the assignments, it was like Introduction to Health Policy, it was in Baltimore, and it was to go to a congressional hearing. And the assignment was like, your boss works for blah, 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 you work for blah, blah, blah organization, and you have to write a memo to your boss about what were the key issues that came out of a particular hearing. And I remember I had one person sent something, it was like, half, like quarter-inch margins, eighth-inch margins with this like teeny tiny font. And I was like, your boss is not going to read this, and I'm not either. You need to think about and distill what matters. What matters in that case, your audience is your boss. In other cases, it's a policymaker. In other cases, it's going to be a funder. Just think about what are they looking, what do they want to hear, and what do you want them to know, right? And how do you make that a conversation?
And that is very hard. You are absolutely right. It is very difficult to distill those messages
Sometimes
down.
it's like throwing spaghetti against the wall. There is no like right answer. And you have to be ready to like pick yourself up, dust yourself off, and start all over again.
I want to remind our guests that we are open for questions for Dr. Salganicoff, as she's here to take your questions about her career, her background, and her research. So don't hesitate to use the Q&A or chat at any moment during the conversation. I want to ask you, there might be some aspects of positions in policy research, policy communications that students might find surprising, or maybe they might not be aware about. I'm thinking about what we discussed when we had a preliminary conversation, some of the maybe less exciting parts about the job, maybe that people who are drafting policy legislations might be up against, the drudgery of the work. Maybe you could talk a little bit about that.
I think I remember what you're talking. Yeah. So it actually relates to the point that I was making earlier about like the passion and also dusting yourself off. One of the things, I was actually thinking about this Build Back Better Act. And when I have been reading it, it's interesting because I'm very interested, and there's a lot there that I think would be really fantastic in terms of policy to help women succeed in the workplace and to improve their health. But I really, like, my heart was bleeding for the staff, who I know were in part of the negotiation and all the work that goes into drafting the legislation, the negotiations, making sure it's okay with the constituency. It's just all of these different pieces. It's a tremendous amount of work. And so you do have to be ready to kind of like, get it going. And I know people have been working, long nights and over weekends and things like that. And then it's like gone. But then think about, okay, on the bright side is like, if it doesn't get passed, there will be other efforts in the future to get, to work on this issue. It may be different than the particular, think about like getting the ACA passed. I mean, honestly, it's like a miracle that we even have this legislation. But, it takes years. I remember I was in graduate school during the Clinton administration, and I remember hearing, I got a job offer, and I was like, should I do that? Should I work in the Clinton administration, or should I finish my dissertation? And I was like, okay, I'm going to finish my dissertation. And, and thank God, because my dissertation was done, but they never passed any health reform. So, those are, there will be, there are other opportunities to try to get things through. But, you do have to be ready for disappointment and really understand, I think, in this country that we are incrementalists, and many of us who, want to see big change, many people, that's often not the way it works here.
When the legislation doesn't happen, or when those drafts don't go through, or when the presentation doesn't land.
Yeah. What was
this
your
is a question? I have a question. How do you keep yourself motivated when policy ideas or hopes don't go as intended?
Well, that's where the passion comes in.
That's
right?
where the passion comes in. Okay.
That's where the kind of like, okay, this didn't work. And it's hard. I'm not going to say it's like easy. Sometimes it's really disappointing, and sometimes you want to like you're stay in bed and put your pillow over your head. But you know, you just have to kind of pick yourself up and, you know, figure out, you know, what you're gonna do. What's your plan B, your plan C, your plan D? And sometimes recognizing that it's going to be a long time.
We do have a question from one of our MPP students who's, I'm going to put you on the spot a little bit. She says she applied for a policy analyst position at KFF. What are your interview tips? She hasn't heard back, but what are your interview tips?
Be prepared to spend some time looking at Kaiser. Really look at the website. Look at the group that you're working with. Look at their projects. I don't know what the position is, but be prepared to kind of demonstrate, you know, your interest, your passion, why you think why you think you would be great, and where you, and be ready to talk about where you can grow.
Okay.
I often ask people like about this job. I always like this question. Because I hate that. Like, where do you see yourself 5 years from now? Like, who the heck knows? But I do ask people like, what do you think you have nailed in this job? If you see this job description, what do you think you have nailed, and where do you think it's going to be a stretch for you?
Okay.
You know, like what, and have thought about that as well. But I do think that showing an understanding of what KFF does, the priority area, and some demonstration of your interest. And then of course, I don't know what the position is, but I'm like, I need somebody who can do R is the, and then all the other stuff is, icing on top. I'm told I can't do R, but.
And she says, and Hannah says, thank you.
Great.
What a great example of like policy to practice right here. This is great.
Exactly. You have a lot of positions.
You mentioned that you are testifying next week.
It's a congressional briefing. It's not a hearing.
Okay, but it's a congressional briefing. So you'll be in a room with a lot of, I would presume, powerful people.
Well, we'll see. I mean, I think I'll be here in Zoom.
Okay, you're zooming in. Okay.
But a lot of the congressional briefings are actually a lot of staff.
Okay.
And so
who are very powerful.
who are very powerful and who have a lot thrown on their plate, and do not have a lot of times the depths or the experience on these particular issues. So we come back to the same issue that I was talking about earlier. What do I want them to know about this issue? So, just thinking about, I'm going to be talking about their focus on the regulation and how to strengthen it. But I also want them to know a little context about why we have this regulation. I also want them to know that even though there are some problems, that the overall issue, like contraceptive coverage, has been hugely successful. So what we are doing is not, like, we don't need to throw it all out. What we need to do is figure out, we have something successful, yet some people are falling through the cracks. So how do we patch this? And so you want to kind of convey all three of those things. You want to, engage their support, as well, tell them the kind of things that they want to hear, as well as share new information that, that's going to be likely not a hostile audience. In other cases, you may be talking to people who absolutely disagree with your recommendation. And I had that situation. I was involved with briefing Hill staff about the contraceptive coverage, the Women's Preventive Services. So we met with all the committees, and you can remember that was very charging. There were 2 cases that went to the Supreme Court. And, one of the committees, they were, very opposed to contraceptive coverage. They were opposed to contraceptives. And, they wanted a conscience provision. They wanted all of those. That was not our role. It was the administration to establish that. But, these were difficult because they were, against that. So you just present your best information and know that, some people have very sincerely held beliefs that they are not going to change. And, facts, no matter what facts you present. I mean, I think COVID vaccination is a perfect example of that. There are people, no matter what you tell them.
Well, I think you highlight the importance of this isn't personal. Really being able to know what is your lane, why are you there?
Yeah.
And when I kind of joked about the staffer also being the important person, we often think that the person in at the end of they're at the end of they're at the sharp end. And the more you can do to help them to be successful with whoever they need to move the agenda forward with, the more successful you are.
All you have to do is watch a congressional hearing and see who's standing behind them and whispering in the members' ears. That is, congressional staff, and even like in state legislatures, I would say. I mean, I want to tell, the students that state health is where it's at right now. I'll tell you, there are a lot of important policy decisions that are being made at the state level that affect a lot of people. And, Medicaid policy is all at the state level. These are critically important decisions that are made, excuse me, by state, made by state policymakers. And, as staff, you could really influence that and really help if you, find somebody who is, really kind of a powerful person or are working on a committee. Those can be extremely rewarding and really have impact.
I want to also remind everyone that early in the conversation, you mentioned your waitressing experience helped you navigate that conflict, those difficult conversations and those kinds of experiences. And I just want to remind everybody that I can imagine you're drawing on that type of conflict in some of those interactions.
All the skills you learn in life. I mean, that's what you just kind of have to really, I think sometimes we feel like there's like skills that matter that count and those that don't. And I think kind of they all do. I remember my neighbor moved in. She used to be a United flight attendant, and now she switched careers to be a third grade teacher. And she said that, her experience as a United flight attendant prepared her very well to be a third grade teacher. And you wouldn't think that those are connected, but there are a lot of, might be the other way around too. So.
We have a couple questions. One is from Rebecca LaBelle. She's one of our MPP students specializing in health policy. And she said, is there something about the field that surprised you that you were not necessarily prepared for, and how did you address it?
Let me think about that. I think one of the things that with health policy that I don't think we think about enough is the interconnectedness that health has with so many of the other policy work. And I think more and more now, it's becoming clearer, that work policy, everything from kind of family leave to sick leave, other types of, even like, earning a living wage and knowing what we know about the social determinants of health. So understanding all of those issues. And I think, one of the things that I always, I thought about doing like a public policy versus a health policy degree, and I ended up kind of doing more public health policy. But I've always kind of felt like I wish I had, kind of a stronger underpinning in some of the other issues. Think about food policy. So many of these issues, there are ways to kind of interconnect. And I think that a lot of times we work very much in silos and really thinking about where are the kind of external levers. And I didn't realize, I think, as much how that all kind of operated. And honestly, I didn't understand how complicated and archaic so many of our policies are. And I know we do, and that's probably because we do things incrementally, but the level of complication is unimaginable sometimes.
We have another question here about internships. Are you looking for something in particular when you're hiring an intern? This is an economics student who has a little experience in community and is now living in England. Does KFF have any remote opportunities?
Well, we're doing remote. We're all remote
Okay.
now. I mean, we're all remote now, and we have we do take interns. We don't typically take undergraduate interns. We usually take interns, and I've had several interns. A lot of folks we've had here through UC Berkeley, because I'm in California, or in Stanford, who have done internships or capstone projects. And some of them have actually, we ended up hiring them afterwards, but we try to have the interns, you're looking for somebody who's done, very well and also has a clear sense of what kind of skills they want to learn when they come to the, foundation, to Kaiser. So yeah, it's hard to say, and a lot of it depends on the position.
I want to remind our audience that we have a few more minutes for questions, so get them into the Q&A or the chat now before we sign off. We have Dr. Salganicoff here with us until 12:30. So yeah, we would love to hear from you.
Now, we were talking a little bit before we got on today about some of the challenges of the remote working environment and the whole question of balance and integration with our work lives. And I'm really just curious, so not only work-life balance, but what's been your experience as a woman working in policy leadership? Have you faced hurdles? How have you overcome them?
I mean, I think that the sad truth is that women need more credentials than men to get an equal position. I feel like for me, having a doctorate, really, even though I feel like I don't necessarily feel I need a Ph.D. to do a lot of the work that I do, I feel that degree, but it got me a seat at the table in places that, in situations where I would not have been able to get there. I think the issue about workplace flexibility is, I mean, hopefully we're at some kind of a, inflection point around that. I think it's really hard. It's really hard once you have kids to figure out how to balance that. And I think, the pandemic has really just accentuated and highlighted the challenges that many women have always kind of been experiencing and dealing with, but has pushed them over to a point where it's just, no longer tenable. And some workplaces are addressing this, and it has to do with flexibility. Those are types of things. And I think for Kaiser, for me, it's been, I've been here for a long time because it's, and I've been able to have, my family, my kids, and, also even before, the pandemic, I was able to, for many years, work from home a couple of days a week because of the nature of the work that I do. Not everybody has that privilege and ability to do that. But I think we've also demonstrated that there is a lot we can do from home. And, now we have the technology to, underpin and support that kind of work. And so, but it is challenging. And I think for women in particular, it's really hard. And, this integration, I think it's like, it sounds really nice. But, at the end of the day, you got your kids need childcare, they need help with their homework, dinner has to be made. And I know that, a lot of the gender roles, there is more balance. But a lot of this still largely falls on the shoulders of women. And a lot of these gender roles are highly ingrained. So those are, really, really difficult. I have these discussions with my husband. Sometimes he'll say something is like, messy or something that, and I'm like, and I get very defensive he's like, I'm not criticizing you, but I think so much of what, we were raised with is like, it's if something's kind of wrong in the house, it's like the woman's fault. Even though he wasn't blaming me, I was just like getting defensive.
You just carry that.
Something, because it's like, I didn't make that mess, but still,
Well, before we wrap up, I want to ask you one last question. If you could talk to us a little bit about what you wish you knew as a student, or what advice you would give to a student looking to follow a similar career path.
Well, I would say, my career path is very, a lot of it is serendipitous. It's very hard to know. And I think that, to the extent you want to completely plan what's going out, like, good luck to you. It's kind of like doing a birth plan. Things happen. I think that you should be open to opportunities, and don't be afraid to do something that you think might be a little risky, but also think about, what you're going to learn from your job. I think a lot of folks were very focused on, like, is this the prestige job? My son is like looking at different organizations, everybody wants to work at Google, but it's like, there's a lot of other places that are great places to work where you can learn a lot that doesn't have to be, kind of that top tier. Be open about kind of what your opportunities are. I was just thinking, like, with health policy, there's so many ways to kind of get into this. This is what's so great about it. Like, you can work for different types of organizations, you can do advocacy, you can do, you can work in government, you can implement things, you can research things, there's so many ways to kind of, work in policy and make a difference, that it's, just be creative. I wish sometimes I had been even a little more creative.
And we had one last question from someone who has asked about sharing your address so they can send you a note of thanks,
Sure.
which was very, very sweet. And we can definitely do that via email or something like that.
My email address, sure. Yeah.
So we can certainly do that for that question, and we would be happy to do that. But we would love to thank our guest, Dr. Alina Salganicoff. We hope you'll join us for the next conversation in the Policy Profile series on Wednesday, March 16th at 11:30 a.m. with guest Pennsylvania Speaker of the House, Brian Cutler, when he joins us to discuss his drive to run for public office and his path to get there. I'm Whitney Sheridan, along with Catherine Baumgardner, for all of us with the School of Public Policy. Thank you so much for joining us today. Have a great day.